We got started a little late this morning, which is 1,000,000% on me. These amazing trainees who are speaking to you today are literally post night shifts or in the PICU or on vacation, and they all have their stuff together and my computer's frozen. So here's a lesson: surround yourself with amazing people who are great at their work, and you'll be able to problem solve your way out of most things. So I am just really so thrilled to give a platform to some really incredible trainees that I've had the privilege to work with and learn from over the years, some of which are almost on their way to new adventures, other places, some of which are about to start some new adventures with us. I hope this is really going to be an opportunity for us to have a conversation and really connect with one another and ask questions and share ideas and really be a jumping off point. And I hope if you're a trainee in the audience that this will encourage you to not be shy about sharing your ideas or the places where you'd like to see your training program or your clinical work go. There are many other trainees. This panel could have had 30 people on it. There's so many people doing incredible work, but I thought the folks that I've asked to speak today really give a great kind of broad lens of different ways that you can get involved as a trainee in anti-racism and health equity work. Dr. Ndely is not able to join us today, but if he were here, I know he would want to remind you to join the town hall this afternoon. This is your opportunity as faculty to share your thoughts and ideas about our clinical work. So please look for that Google Calendar invite and join that meeting. So really our goals for today are to appreciate how trainees can help to shape anti-racism and health equity curriculum, their learning environment, and the clinical care that we provide, to identify some of the current initiatives with some examples from what our University of Minnesota trainees are doing. And then I hope we'll have some time at the end for the trainees to share their expertise about things that have helped them along the way to create effective partnerships with other trainees, staff, and faculty. So without further ado, I will let them introduce themselves and then tell you a little bit about what they've been working on. Please feel free to put questions in the chat or in the Q&A, and we're going to leave plenty of time at the end for us to connect with one another and have a discussion. So again, that's our kind of overview. We'll let them introduce themselves, and here they come. Dr. Donlon.
My name is Tobias. I am a PEDS intern. I grew up in Minnesota, went to the University of Minnesota for undergrad and for med school. In med school, I was really involved with White Coats for Black Lives, which I was involved in with Anisa, who you'll hear from in just a moment. And that's really where I got passionate about DEI health equity work. I'm also really interested in medical education and in pediatric cardiology. So those are my future directions.
Hi, everyone. My name's Anisa. I just graduated a couple weeks ago from University of Minnesota Medical School. I went to Carleton for undergrad before that, and I am about to start my residency in Med-Peds here at University of Minnesota. I have done a lot of similar activism as Tobias, have been very involved with White Coats for Black Lives as well as SNMA, and am very interested in health equity and DEI work specifically through a lens of medical education and medical education reform.
Hi, everybody. My name is Elena Galindo, and I am from Clemson, South Carolina, which is actually where I am coming to you today. I haven't seen my mom in about 18 months, and so I surprised her, and it was everything that it should have been. And so I went to Clemson for undergrad, and then the University of Louisville for medical school. And now I am here finishing out residency, and I'll graduate here in a couple of weeks. And the thing that I did in undergrad that I also really wanted to replicate for medical education was trying to just build bridges with regards to how we approach cultural competency or cultural understanding. And so I was able to do some of the resource or some of the lectures that I'll talk to you about in a little bit. But one of the biggest privileges of my residency has actually been becoming the national AAP rep for the University of Minnesota Pediatrics. And through there, I've been able to get involved with the EDI work group for the national and actually Minnesota's AAP's EDI work group as well. And then next year I'll be going to CHLA in their Adolescent fellowship program.
Morning, everybody. My name is Simon Ndely. I am a third-year pediatric resident, born and raised, homegrown in Minnesota, in Brooklyn Park, Minnesota. It's my 13th year at the university, so it's been a very long time since I've been here in multiple different formats. They've paid me, I've paid them. It's been a whole relationship that we've had, and I've loved my time here in terms of getting into different multicultural diversity organization. That's something I've been doing pretty much since I started college. In medical school, I was involved in SNMA with starting off as a first-year representative with my co-first-year representative, Miss Anisa. And then she became my chapter president while I was her vice president. And then from there, I actually became regional director for the last couple of years of my medical school tenure. And that was when I really got to see the large scope of seeing more diversity within medicine that you don't get to necessarily see in the lens of sometimes your home institution. And when you get to have that inspiration out there, you want to be able to bring that to an area where it's needed as well too, and for the community that we want to serve, it's needed. Part of that reason is why I got involved in the graduate medical education with the Diversity and Inclusion Committee. Because one of the main things that I wanted to focus on were retention and recruitment of residents of color, of underrepresented residents in medicine, because we still have a large community that we need to serve here in Minnesota, and I wanted to make sure that we are doing all that we can in order to continue to grow that support system that is there for them.
Hey everyone, thanks for having me here. My name is Bryan Leyva. I'm a PGY3 at the University of Minnesota. I consider myself a scholar activist. I have a background in public health, community organizing, critical race theory, intervention research, and implementation science. And I'm very passionate about diversifying medicine and decolonizing medical education. I graduated from Boston College with a studio art and biology degree. And then I did 6 years of research. And then I went to Bryan University for medical school, where I was engaged in things that I've been engaged in for pretty much all my life, which are topics around diversity, equity, inclusion, and justice, as well as mentoring underrepresented youth in medicine. I guess I'll talk a little bit about kind of what I wanted to address, which is kind of the role of social media in kind of advancing anti-racism and health equity work. I think that social media is very powerful. I think we've seen it through the Black Lives Matter movement and what it can achieve in terms of bringing some sort of accountability to institutions that historically have marginalized people of color. And I think that similarly, I've been trying to harness social media to try to not only educate and raise awareness about topics related to health equity, and to empower people with information so that they can get involved in these efforts more and feel comfortable in doing so. I think social media is very powerful and can contribute to local level efforts to the extent that it can raise awareness through publicity of events and initiatives. Social media is very powerful in that you can engage in advocacy. So in all forms of advocacy, right? As a person who's part of the University of Minnesota, who's within the institution, I think it's important that we are at the table and getting involved. Advocacy involves, listening to different perspectives, amplifying perspectives that aren't often there, campaigning, doing research, analyzing issues, which I think can be done very astutely through social media, in that you can do community analysis of issues and get different perspectives easily and quickly as the events happen. I think is very critical, and we've seen it in terms of building network and alliances, and I'll talk a little bit about how I've done that. And I think it also can give you a way to do activism as well. Oftentimes this is kind of a very simplified version of advocacy and activism, but some people see activism as working within, outside of the bounds of an organization. Some people see advocacy as working within the bounds of an organization. And I think you can accomplish both. I think I've used social media to launch campaigns, targeted campaigns against institutions that I think have needed some sort of external accountability. I think I've used it to implement letter drives, voting drives, change.org petitions, fundraising drives. All those things I think can be accomplished through social media. And I think that when we think about community organizing, I think social media has the unique power of breaking down barriers of location. Right. So when I say a community, when in a social media platform, I'm talking about global community. I'm talking about national community. I'm not just talking about the people in my city or in my town. And I think it also enables you to hold individuals and institutions accountable, this idea of institutional accountability. Social media also has the ability to help us establish systems of mutual support, which is so important when you are a person of color navigating predominantly white institutions that oftentimes are instigators and perpetrators of racism. And so I think those are just some of the ways that I think social media can be used to advance anti-racism and health equity. Some examples in my personal life, I'll start with an organization I started called Woke Doctors. Maybe some of you guys are part of it. Pretty much we use it as a means to really raise the voices of marginalized groups. We don't expect everyone to agree with everything that we post, but we think that it is critical that we raise and raise those voices. We use it as a form of organizing. We're in many platforms, from Facebook, Twitter, Instagram, TikTok, and Clubhouse. I'll give you an example. That video that you see at the bottom right is a video that I did actually during the first protest of George Floyd, and you saw that it was viewed by 2.1 million people. I was able to be on NBC as a result of that publication. I was getting contacted by press across the country to give my perspective as a physician because of social media. I'm going to move forward to another example. We have this group called Forever Wakanda on Twitter, and it has really served as a source of emotional support. As we're in these institutions that are predominantly white, how do we create systems of support for the people that are in it? It also has led to an organization as part of the Institute of Anti-Racism and Medicine called the Black Healer Network. We gotten together and we created this anti-racism health summit. We've done 3 so far, each having between 60 to 100 people who are engaged in this work. And that work has led to a campaign, particularly holding the AMA accountable for the podcast that they released, and for really the history of abuse and marginalization towards Black communities in the United States. What has resulted from that is just last week, I was in a meeting with the AMA president and several members of their executive chair. They've released now over a 100-page report on what they plan to do in the next 3 years to advance health equity. And this, it actually was a result of their actions, but it could not have been possible without the organization that we were able to accomplish online. I'll bring another example which is actually one of the main reasons why I created a personal account on Twitter, which was I created this hashtag called Latinx Med Twitter. Black Med Twitter was going strong, Med Twitter is going strong, and we needed a place where Latinos can talk about the issues as they are. places where we can speak in Spanish if we want to, where we can raise awareness about Latinx specific health issues and concerns, and also policy issues, right? And where we know where we're going to reach an audience. And so I created this hashtag and I pushed it aggressively. This then became a list. I think I have the biggest list of Latino providers on social media. And then we use then that list to then to push this organization that we're forming called the Latino Coalition Against COVID-19, which is modeled after the Black Coalition Against COVID-19, who's done phenomenal work in advancing COVID equity and COVID vaccine equity across the nation. So these are just some examples of ways that I've used social media. You know, I'm both on Twitter, where I really share my thoughts. On Instagram, I was a prior micro fashion lifestyle model, and I really have changed the focus of my posts to meet the times. And so with that, I'm done speaking.
Hi there again, my name is Tobias, and this is a project that I worked on with Anisa Suleiman, who you'll hear from in just a moment also. We developed a health equity undergraduate medical virtual elective, and we're now working with the DEI Trainee Council and Dr. Borman-Shoap to develop a similar elective for, or similar resident level elective. But our work really started about 4 years ago when we were in our first year of medical school, with this picture in the upper left that was put up in a first semester med school course. And it's an adorable picture of 3 kids playing, but it was narrated by our lecturer as the child on the left stealing the girl's toy and the child on the right who won't leave her alone, which firstly, there's nothing in this picture that you can determine the children's sex, and certainly not their gender, which hasn't even developed yet. But also the words, you know, stealing a toy and won't leave her alone are words and phrases that are commonly used to villainize Black and brown bodies. And it really represents a lens and a worldview through which our lecturer and many other people in this country view the world, where Black and brown children, and certainly boys, are typically viewed as more aggressive, and especially white girls are viewed as innocent and pure. And this worldview can really become a major problem as folks get a little bit older and are viewed by police as aggressive, are viewed as resisting, are viewed as defiant, and results in disproportionate rates of people getting pulled over by police, results in harsher sentencing, results in things like phones and wallets being mistaken for guns and people being labeled as resisting arrest. So just this image, kind of after we saw this, I immediately texted Anisa, who at that time was the only other med student that I had talked to about race and racism. We were both like, did this really just happen? And it did. So then kind of moving forwards, we're like, well, what do we do about this? And kind of after a culmination of many other similar events, we came to the realization that we really needed to revamp the way that race and racism is taught in medical school.
Yeah, and as a result of our frustration really with the lack of health equity education that we were receiving, in addition to these, you know, kind of racist experiences, problematic experiences at every level, honestly, we ended up essentially working to educate ourselves through student groups and lunch lectures, and we eventually created a health equity elective under the guidance of our faculty mentor. And we have now run the course over 5 academic blocks, as well as to 2 of the longitudinal programs that we have in the medical school. And essentially we provide foundational knowledge for students and a framework to really learn about and participate in health equity work. We're continuing the course next year. And as Tobias mentioned, we're also currently working with the pediatrics department to help create a similar health equity elective for pediatric residents.
So this was the curriculum that I was talking with Emily about actually at the beginning of my third year, that I really wanted to create. The idea behind it and the purpose behind it was to try and address some of the thought processes and like subtle microaggressions, and that were more reflective of the broader beliefs that were held by some of the residents or the residency program, or also other physicians and attendings and interdisciplinary team members that we work with in the hospital. One of the things that I have always tried to do, or the belief that I have always had, is that we are stronger together, but when we as individuals are also working to build our own knowledge base surrounding very important matters. And then when we come together, we can ultimately provide better care. And so the thing that I wanted to tackle first was redlining, and not just so much like the historical aspects of it, but how that history closely ties into the present, and most importantly, emphasize how it is still affecting our patients on a daily basis. In particular, our Black and Brown patients, and how poverty is, it's hard living in America being Black and Brown. And a lot of it comes from systemic decisions that were made a long time ago that still have a very present, palpable sensation and affecting many of us on a daily basis. And so at the end of each lecture, I really tried to focus on tangible action steps that the listeners can then take forward and immediately implement into their daily lives. And so such things as, whenever you have a patient that has food insecurity, why do they have food insecurity, and like what things are at play? And so by knowing that, you can at least help circumvent the system. The next lecture that I gave was on voter suppression, and this was around the time that we were voting in the presidential election, and just going back and looking at how the suppression of Black voters is nothing new. The tactics that are used are also nothing new. And how moving forward, really one of the most important things is, in addition to the trying to narrow the racial wealth gap, is also making sure that we ensure that Black voters have the true freedom at the ballot box, and also representation within government itself. And so I really enjoyed this curriculum, and I feel like that, in addition to the med school and now what will be the residency elective that Anisa and Tobias are doing, it kind of brings it full circle, which is, I did not know that was happening, but it's also super cool.
I just want to know I have amazing peers and amazing friends who are doing a lot of amazing things. It's really great to be a part of, even with that the lectures that Elena was noting. They were very, very hard-hitting, unapologetic, and real. And I remember because of that, it was a really positive intake that it was taken by a lot of people, because it's just things that needed to be talked about. You know, those are part of the frameworks of kind of my involvement in getting into the graduate medical education and putting more emphasis on underrepresented residents in medicine, and making sure that their experience here, and their experience here in Minnesota specifically, is something where they feel like they can thrive in. We have so many different Black, and I can speak for Black professionals who are coming here as transplants and come here for their few years and they leave. And sure with a lot of you guys attendings and program directors have seen that in your programs, where they're here for a period of time, but you don't seem to have them stay for a longer period of time. And I've been here and I'm born and raised, and I know so many amazing things that Minnesota can provide any individual, no matter your skin color. You know, but navigating some of the systems, navigating some of the social interactions that happen here are different from people that come from out of state. And that is just an honest truth that even to myself, being here and being Black, some things I don't see because I grew up within this system. And so when we kind of recognize those things, how do we bridge that gap? How do we provide more culture supports for the individuals coming in so that they can see that not just that this program here somewhere that they can be, is the state somewhere here they can be. That's how you can retain somebody as a whole. Since this is a new stage in life for us, we are looking more so as where are we going to buy a house? Where are we going to raise a family versus when we're in college, choosing an area of what campus do we like and friends that we'll get to see on the day-to-day. And so when we're recognizing that, how do we introduce Minnesota as a whole as a place that is suitable and attractive to residents of color? That's part of where my main goal, again, in the graduate medical education, and really being able to provide more of a cultural lens of Minnesota, different areas where you're able to find other Black professionals or other Latino professionals in the city, where you're able to find other cultural foods that that are more so kind of what you've made at home, where you're able to find other communities of underrepresented communities that you came into medicine wanting to serve and finding connections that that are there. When this kind of transitioned into, you know, focusing a lot on specifically Black doctors is when the George Floyd shooting happened. I mean, kneeling and killing happened. That was a big rock to a lot of individuals, including myself. And I remember on that day, or was it the next day, I called like all in the med peds and peds, like all my Black med peds and peds colleagues. I called Bryan, I called Elena, I called Parisha, I called Maju, just to check in on them, just to see how they were doing, what their thought process was with everything going on. If you think about it, especially with all these different large racial tensions that are happening in this world that we continue to have to deal with because we are part of this society, we then are the ones going in and treating these patients. We're treating these kids coming in after the shooting or the cops who are hurt in these different types of situations. And we're seeing this also in real time. And to be able to think about how, you know, a trainee who has so much of these other things on their mind, along with so much of the stress that's coming from work, and then having to put all that and compartmentalize that in order to do the work that they're meant to do, it's not an easy task. And especially when you have so many transplants coming in and not being able to have a cultural support system here, because in their program, they're the only Black person, as an example, you don't really have people to really feed off on. And so I was fortunate enough to have some friends within the Med Peds and Peds program, but I recognize not other individuals from some family medicine programs or some ENT programs. They didn't have that same type of connection or as close of a connection. I talked with my program director, Dr. Borman-Shoap, for an hour on a lot of these things as well, in terms of my experience and how I felt about it. And I want to make sure that everybody else had those same type of lens too. So I connected with one of my fellow residents, Maju Hammond, and we ended up starting what we now call Minnesota Black American Doctors. And this is just an organization that's focused on supporting Minnesota Black residents from all across the state in order to make sure that they understand that there is a culture, there is more than just the one or two that they see throughout individual rotation, to be able to connect with and learn from and be able to share experiences in order to help navigate this crazy world of medicine in a better and hopefully more positive light. We started with a Zoom meeting shortly after the killing of George Floyd, about a week or two after. And it was a very therapeutic in that sense, in order to be able to kind of check in with everyone and see where they're doing, and able to see so much more Black residents and faces that I have not even gotten to meet before. We even involved other Black attendings who also join the event and frequent our meetings as well. Through that, when we were looking at the state of everything that's going on, this was also just prior to orientation, at the same time of the year last year. And so we were just thinking about how all the residents coming in to this state, where the largest protests that have ever happened in the world are happening in Minnesota, out of all places, is the epicenter. How in the world would you think somebody that's never been here, how would they feel about coming to this area for 3+ years, not even knowing anything else about it, but the fact that they love the program? This is something that we did not want to sweep under the rug. As we know, Minnesotans, sometimes we can be very Minnesota nice and not try to talk about the bad, right? Because we just want to focus on the good. But to be able to get to the good, we have to be able to confront the bad. And that is something that sometimes I feel like us as a state, as a people, and fault on, and we need to make sure that we kind of redirect that. And so we brought essentially a list of demands to the GME office, who were very receptive on it, in terms of being able to address the elephant in the room in orientation. What ended up coming from that is at the start of orientation, Dr. Kaz-Nelson, she gave a couple minutes of the introduction, and then it was on us, where we had a panel of different Black residents just kind of speaking about our experiences here at the university, welcoming the students, but then also showcasing a support system for them and hoping to bring a different lens, not just to the Black residents that are coming in, but all the other residents that are coming in terms of what your fellow colleagues can be dealing with, thinking with, and are experiencing throughout this otherwise crazy world of residency in general. To be able to give a different perspective, a different lens of how to be able to look at situations and how your interactions with your interprofessional nurses and things like that, especially in the wake of all these things that are happening, can really impact some of your fellow colleagues. It was an hour-long session, and I think I made it to every single one. There was like 4 or 5 of them in order to have this conversation, and they're all very well received, to the point where we are redoing this again this year at orientation. And that's how it's starting off. So orientation started off heavy, but it was rightfully so. With the Minnesota Black American Doctors, we wanted to make sure that we continue to grow this network and be able to make sure that we see that there's this support system and introducing these Black residents to more parts of the community. And so when COVID restrictions started to lift, we, and also in the wake of another shooting of a Black male here in Brooklyn Center in Minnesota, we really wanted to have an opportunity where we actually could see each other face to face, because everything's been in Zoom since we had started. And so I brought a proposal to GME once again to host a Sunday brunch for MinBad, and for us to be able to kind of congregate for the first time and fellowship. And one of my main focuses was to do that at a Black-owned business. And this with Black-owned businesses are that we're catering as well too. And this is just to provide the culture to the people that are coming in, so that outside of these events that we're having, they know that these are other places where they can see people that look like them from other professions and be able to kind of be more a part of the community within Minnesota as a whole. That is going to be the main thing, in my opinion, of how we are actually going to be able to retain these residents of color, is being able to find, is there a sense of home for them here, not just a sense of a strong program. The event went amazing. It was a really great time. And a lot of people really just enjoyed being able to see each other face to face. There's some people I had never met before face to face that I've talked on Zoom multiple times. I had brought another proposal for us doing a very similar thing like this, a BIPOC orientation happy hour that we'll be doing during the weeks of orientation in the coming month. And this is just an opportunity, again, to introduce the new incoming interns to other residents of color, knowing that there is a larger community than what you may be able to see on the day-to-day, and that we are here to be able to provide more culture for you as a resident in order to feel like this is a home and a place that you can be able to stay for a longer period of time. So I am happy with and I'm thankful for the responsiveness of the GME in order to do this. And I thought another real big thing that I wanted to happen, because of how much I love the University of Minnesota, but I also want to challenge the University of Minnesota. You guys need to be able to put your money and your words where your mouth is, in order to be able to show the residents of color coming in how you really are making this a priority for you, if that's financially, if that's socially, or whatever the case may be. And so with them sponsoring it, these are things that we as residents can continue to help recruit more residents of color, because the university is showing that they're taking in a concerted interest and a financial interest as well in making sure they're bettering the environment for residents of color here. And so these are the different types of ways I'm hoping, even though I am transitioning to fellowship over in Cincinnati, that we can continue to grow this work and bring a stronger connection between the residents of color and the actual state of Minnesota. And I have a video of the event that Ramla, who is a family medicine resident at St. Joe's, who is third year, she just put a quick few second TikTok of the event that we had this past Sunday.
Thank you all so much for just sharing your incredible work and expertise, and for really pushing us to do more. We need a lot of pushing sometimes, and I just have been so honored to learn and work with all of you. I think you can probably stop sharing screen, Simon, and we can let everybody see your wonderful faces. And I see a lot of stuff coming in the chat here, so I'll maybe just kind of read out some of the things, and if you guys want to have comments or respond. This one comes from Andy Rezepka, who's a general pediatrician, practices in Brooklyn Park, has for a long time. He says, I've always found it interesting that we want undergrad students applying to our medical schools as smart, independent, and forward thinkers. But when these students sit in our classrooms in the first and second years and beyond, it seems like we resist being challenged about our thoughts, lectures, and idea. So going back to that cute photo of the 3 infants, did anyone challenge the professor giving the lecture during the lecture? If not, why not? If so, how did they respond? How do you think they might have responded, or just other thoughts about that situation? So I think there's a lot in there, probably about power dynamics and being a first-year student, and the general milieu of a lecture hall. But it sounded like in the moment you were really bothered by it. And I just would love to hear the two of you reflect a little bit more about what you remember about that kind of pivotal moment in your education.
I remember that was pretty, like you mentioned, really early in our medical education. It was the first semester of first year. Anisa really became known for the person who educated a lot of lecturers and faculty when problematic comments were made. Often it wasn't particularly well received. Often it was, there's a lot of defensiveness, a lot of kind of rationalization that happens. And I'm sure, like you mentioned, a lot of that is the result of power dynamics. And, we were first year med students. So we, and Anisa, you can speak more to this too, probably, but we kind of got frustrated with, especially Anisa, doing a lot of education of faculty in addition to all of the other things that you do as a first year medical student. And we ultimately went to administration and kind of brought up some of these concerns, and that resulted in some additional education and training that occurred kind of from a top-down perspective. Anisa, do you have anything to add?
Yeah, I think we tried a lot of different methods of counteracting these things. So for that, the instance with the infants, we both filled out feedback cards, which is something that the lecturers get access to later. So, and we kind of explained why we thought this was problematic, and we never heard anything, as often happened with feedback cards. I think once someone kind of publicly apologized for something really problematic they had done, based off of a bunch of feedback cards that they had gotten complaining about it. But typically that wasn't a very high yield method. And then, you know, from saying things in lecture to kind of my go-to was in between lectures was to go and speak to the person kind of a little bit more privately, just to not, you know, be able to ask them some of those probing questions without feeling like, you know, I was putting them on blast in front of a bunch of students while they're trying to teach, which I didn't want to do. And I think early on, especially, it often led to a lot more work for us that, I know one of the first times I kind of complained about something was there was the History of Medicine lecture series was just 4 hours of just only, they talked about exclusively white men, and they mentioned one white woman, and they went back like thousands of years. And I met with someone, I was like, hey, you know, I feel like I don't know, because all I know about history of medicine is what you've taught me, but I suspect that this is not it. And I suspect that there's more. And I was assigned to go and look those things up and then email this person a number of changes that I would like included for next year, as long as it didn't add to the time. So I literally started by Googling like minorities in medicine. And so I think the reactions have really varied to kind of like receptive, but ultimately problematic, to, you know, not so receptive and defensive. And yeah, I suspect if we had talked to her about it in the lecture, it would not have gone very well.
Can I add something to this as well? I think ultimately, like what Tobias and Anisa are also alluding to, is that a lot of the responsibility of quote unquote calling people out falls on the people that it actually shouldn't, which are the learners, the Black and brown people, the minorities, those that have been like assaulted on a daily basis with microaggression after repeated instances of being told that we are not worthy and we are not valuable and we are not like worth the time of going through the putting in that hard work to make sure that our needs are addressed and that our representation matters and it is also present. And what is just unfortunate is that that same struggle perpetuates in residency as well. And I think one of the biggest, like, if I were to like take my dream and like make it come true to fruition with those lectures that I gave, it was that ultimately we would have been given the verbiage to both address what needs to be addressed in the moment, and then you move on with immediate change. That, yeah, like I said a microaggression right there, or yeah, that's actually a frame of mind that needs to be addressed about this patient, about this picture, about how I approach Black and brown people, how I approach their education in both medical school and residency. And I will put in the work to make those changes. And unfortunately, like even personal experience has told me in residency that that's never really the case. And so I think if there was one thing that could come out of what Anisa and Tobias were just talking about, but then also I think what Simon, Bryan, and myself are also trying to get across is that it's not the responsibility of Black and brown people to teach others on how to be not racist. And a lot of that really falls on the individual, and the individual makes up the institution. And if the individuals are putting in the work, the institution itself by proxy will then appear and actually be more open and welcoming to Black and brown people, which will then address what Simon is talking about with retention of Black and brown residents. And it'll address what Bryan is talking about with advocating for the needs of Black and brown people, because it won't put in as much work. It will just be the right thing to do.
Thank you so much, Elena. Go ahead, Bryan.
I wanted to add that the focus should be on equity and justice. And if you focus on that, you're going to get diversity and inclusion. So the outcome, the focus needs to be on equity. Diversity and inclusion is a byproduct of that. If you have an equitable system, you're going to have a diverse and inclusive system.
Thank you. There are many just wonderful thanks in the chats. I hope you guys are taking a look at those. Gail Brotman wondered about the National Medical Association and if there's a Minnesota chapter that you're aware of. I don't know if maybe you are working with that group.
Yeah, I am aware of the Minnesota chapter. We did contact them with them, pledging some support to our event. Some of the members of the chapter have come to multiple meetings that we've had. In terms of our work with them, that's something that we are continuing to tease out the different types of ways where we can really work together. The reason why we wanted to create an organization that was separate from actually the attendings and the Black doctors as a whole, the chapter from NMA, is because there's resident and fellow specific concerns that we want to make sure that were really addressed. We're in a heightened stressful environment, in a training environment, where we're kind of separated from a lot of other people, and a lot of that's due to how much work we have and diving in. And when you have some of these different types of experiences that are there, we wanted to make sure that we had a focus on residents and trainees at this level of their career. But they are definitely people who we've connected with and will continue to connect with in the future.
This question comes from Cindy Howard and is kind of following up on what you were talking about, Simon, about creating that feeling of home and belonging for our residents of color. She says, thank you so much for all the work you've done in the EDI realm. Amazing. Question, how can we as faculty provide a home for you in residency? What are the practical things we need to do as a program and as individuals? Thank you.
I swear to God, this was the exact question that we were talking about, how we were hoping and praying was going to be asked, like almost word for word. So thank you, Dr. Howard. I want to give everybody else time and space to answer this, but I think one of the things that I would say would be putting in the work to be conscientious about your own practices and approach to how you subtly reflect the importance and the value that you put on education of all residents. And what I mean by that is, do you put in the time necessary with your Black and Brown residents to lift them to the level that you want their practice to be at? Or because it's just easier, you put in time with your white residents and just hammer your Black and Brown residents and feedback of like, well, they didn't rise to the level of their peers. I'm recognizing that there are systemic issues at play with regards to the education, the medical education of your Black and Brown residents, that inherently they may be starting from behind with their white counterparts. So like, are you addressing that in rounds? Are you addressing that when you are their attending or their teacher? By doing so, you are empowering them by giving them the education and allowing them to make up that gap and finally be even with their white counterparts. And recognizing that you do hold that power, being in a position of power in charge of somebody else's education.
Elena, I wanted to add on to everything that you said, which I think is so important. I think that every single business unit at this institution ought to invest in a diversity, inclusion, equity plan. Every single business unit. So that means every clinical department, every residency program, every administrative office. I think when we see that kind of investment as residents, I think you're going to start, that kind of investment brings around a lot of introspection, right? I literally am asking residency programs to look at your program, look at your residents. What percentage of them are Black? What percentage of them within Black are African American? What percentage are Latino, right? What percentage of your faculty at different levels of tenure throughout, are people of color? What percentage are Black women, right? How are we paying our clinical staff, right? Are there inequities in pay? We know they exist in every single other institution, but we haven't done, most institutions can't tell you that, right? Most institutions can't tell you what percentage of their clinical department are Black and brown, or what percentage, it can give you the trends in, with regards to racial and ethnic membership. If you don't have answers to those questions, how are you going to fix a problem? Right, and so it really requires that introspection, looking inside, doing the research, right, into your own program, and in that process, you're going to easily identify opportunities for improvement. And I think when the culture is one that values Black and brown lives, Black and brown people, and patients, which I think is ultimately the end goal, are going to feel valued and included. I think that's also another thing, right? Is how is our work linking to patient outcomes, and how are we making sure that when we're thinking about diversity, equity, inclusion, and justice, that we're also including the recipients of healthcare in that definition, and that we're challenging the ways that we engage with our community stakeholders.
I think personal opinion, it's hard for me to be able to pinpoint like exact things you should do. Black people, Latinos, they're not monolithic, and so not everything you do for one person can be do for other. I think a big thing that I said that I always try to say is like, don't be afraid to be wrong. Don't be afraid to make a mistake. Sometimes you need to be able to do that. Think about how you allow us as trainees to speak on, I'm on a HEMOC rotation, and I'm trying to talk about this darn protocol, LXL, I don't know, some things that I have no idea of what it is, and the different types of chemo drugs that I've just experienced, read for the first time 20 minutes ago because I'm an intern. And then you have us kind of suffer through it in a sense, because we kind of need to learn some of those pitfalls here and there so that we can get to a better spot by the time that we're done on the rotation. It's the same type of thought process, but just for yourself. As you're continuing to go on this journey of anti-racism, like it's not something that you get right. I feel like people also don't understand that this is a social construct that affects everybody. So not just because you're white, you as a Black person, as a Latino person, we all have the same intrinsic thought process of certain races and certain things, these certain stereotypes, because that's what's been ingrained into our society. It makes it easier for us because we are also Black, people who are experiencing some of these negative interactions, when we know the type of people that we are, or hear from our friends who are experiencing this negative interaction, when we know the type of people they are, we have more people around us to be able to see that this more Black and brown or people of color around us to be able to see that a variety of different type of experiences of people who who like to code, people who love to play basketball, people who love medicine. Like we see a wide variety of people because those are the people that we're around. And sometimes when you have other individuals who are not exposed to as many Black people who are also not monolithic and have a lot of different interests, you may think one certain thing of what society is pretty much telling you of us. And so opening your mind from that and not being afraid to be wrong. If you see something that is of concern or that you're questioning or you don't kind of understand, and you feel like you want to learn more, try to learn more. Not everybody's going to be receptive to that. You may, and that's okay too. You know, there's Black people who don't feel like they have the time, energy, and just mindset to be able to bring every single person through this race journey. And they shouldn't be expected to when they're already going through so many different types of trauma before. But then there's other people who feel like that is a therapeutic thing for themselves when they're able to have an interaction. It's okay to try with somebody, and it's okay to accept that they don't want to. Because this is not something that they should be expected to do in the first place. As Elena said, you're asking the victim to treat the problem when that's not how it should be. Even though that is a strong source of learning, I totally understand that. I just want us to be able to make sure that we take ourselves out of the situation and really just try to learn what you need to learn. This is not about you as an individual, it's about the system as a whole. And if you can take yourself out of it and take your personal perceived guilt out of this situation and be able to learn a little bit more of a different perspective, I think you'll get a farther way with the residents of color that you may interact with.
Yeah, I would also add that when it comes to the question of home, that I think a home involves a sense of comfort and belonging. And as, you know, minority residents, I think I would focus on the individual work as well of if your personal life has no, you know, you have, you know, if your family is mostly white, if your friends are mostly white, if your, you know, your social circle outside of medicine, and everyone has implicit bias, everyone is prejudiced, like this is true for all of us, myself included. And I think if our living situations are homogenous and we have this internalized prejudice, I think it's just this like a master plan to make different residents feel uncomfortable. And I believe I would, you know, push back a little bit on what Elena said, that I would expect your Black residents to be excellent. And if they are not excellent, maybe you're not appreciating what they're bringing to the table, or maybe there's like a system or structure issue, or maybe something that you're doing that is, you know, not allowing that excellence to come through. And I think when people have implicit bias, which we all do, that we feel that. Like I can tell you as a Black medical, you know, recent medical student, soon to be resident, like I can feel it when people are not comfortable, or when they're overcompensating, or when, and I think it just takes away that sense of comfort and home. And I think it, you know, and I would just ask yourself, if a trainee were to tell you, if you were to elicit feedback and a trainee were to tell you like, hey, you know, like you did this and I, you know, and it was racist, or if they were to tell you that you were racist, how would you feel? Like, would you feel that they're just angry? Would you feel really defensive? Or would you be like, wow, we are all prejudiced. All of us have some sense of racism, and that is something we all hold. And I will really take that feedback and I will think about it, and think about not only my medical, like my life in medicine, but my personal life. And, you know, do I not have Black friends? Do I not have Black family members? Have I never dated someone who's a person of color? And I don't mean the answer is go find a Black friend and that's going to fix your problems. But I just think that sense of comfort and belonging, honestly, in my experience in medicine, doesn't exist. And I think it's because people are not doing that personal work of being like, wow, I would be happy to be told that I'm racist, because then that means I can work on it. And I think that I would just encourage everyone to do that work for themselves.
150%.
Yes, ma'am, Anisa. Yes, ma'am. But also, just a plug, we also have to like lead with, like, if you are in a position of power, recognize that and do everything that you can to make it very clear to those under you or working with you or for you that you want this feedback. Because as all of us have been rarely in a position of power, it takes a lot of guts and a lot of courage and a lot of swallowing that really big lump in your throat to speak up, and like say it directly to your attending or your teacher that you're working with, that, hey, you got some work to do. So I would definitely, I think, to directly answer Dr. Howard's question, the most tangible thing that you can do to make your residents feel comfortable is make it clear that you welcome this feedback, but then also accept it with grace and gratitude, and then go forward and do the work necessary to address their concerns.
I want to add one thing about I'm always talking about decolonizing spaces. And what I mean by that is making space. So sometimes it means that you're not necessarily doing the work, right? Sometimes it means that you are making space for other people who are of marginalized identities to step in, take in leadership, and make some change, right? It means when I say make space, I mean in every single way. Make space in your curriculum to talk about, to bring back what Anisa was talking about, to talk about Black contributions in medicine, contributions of women in medicine and surgery, right? Make space in your hiring processes, make space in your leadership. Decolonizing means moving out of the way in many ways and allowing and allowing other people to shed light onto some of the ways that we can move forward as a program to advance health equity. And so I think a lot of times what stops or what impedes progress when it comes to anti-racism is not necessarily what we do, but rather what we don't do. And I think giving way for people who are very passionate and interested, raising them up, amplifying their work, providing up panels like this. And I'm very grateful for Dr. Borman-Shoap for doing this. These kinds of opportunities really help to contribute to a sense of belonging, not just inclusion, but really a sense of belonging, which is, I think, what we all long for in a place where we spend so much time in. I'm done speaking.
I cannot possibly add anything to the wisdom that has been shared. So I'm just going to thank the incredible, incredible physicians on this panel and encourage all of the faculty. We just need to get out of the way and let them lead. And we need to stop being teachers and start being students, because we have a lot to learn and there are teachers in our midst and they are ready to teach us. We need to be ready to learn. Thank you, thank you, thank you to all of these wonderful doctors. You are incredible. They are literally post-night shifts in a PICU call room on vacation. Residents are incredible people, and we should just, any resident you see today, you should buy them a cup of coffee, especially if they're a Black or brown resident, get them a whole lunch probably. So just really thank you for an incredible session. I hope we'll have more like this in the future. I'm so excited for some of the things we're going to be working on in the coming years. I'm already working on getting Simon and Elena to come back here after fellowship. That's on my to-do list. Everyone have a wonderful, wonderful day. Yes, that is absolutely. He's already had my pep talk, Madhu. Yeah, I think just get ready to learn and don't be afraid to do it wrong. Simon taught me that. He said, just try, and don't be afraid to try something that seems like it might not be enough. Elena gave a 30-minute talk, which was one of the best talks on anti-racism I've ever seen. It was a masterclass, and that 30 minutes really changed and open people's minds. So don't think it's not enough. You got to start somewhere. So thank you. You guys are amazing. Everybody have a wonderful, wonderful day. All of these amazing people, many are on Twitter. They do lots of tweets. I do a few tweets, but you can connect with them that way. I know they'd all love to get emails from you and connect and work on projects as well. Thank you all. Have a great day.